Infection-induced kidney disease are of concern for clinicians because timely detection and treatment of infections may cure or limit the extent of injury inflicted by microorganisms causing infection. Infections can cause kidney injury by either direct invasion or indirectly by immune-mediated mechanisms, which manifest as post-infectious glomerulonephritis or infection-related glomerulonephritis. Clinical manifestation may be acute or chronic depending on the microorganisms, endemic or epidemic natures, and the source of infection. The spectrum of infection-induced kidney disease is diverse. Infection manifests in form of several renal clinical syndrome, acute kidney injury, acute and chronic glomerulonephritis syndrome, nephrotic syndrome, acute nephrotic syndrome, acute or chronic tubulointerstitial nephritis, and rapid progressive glomerulonephritis, and others. One of the most common presentation is acute kidney injury, which may occur either de novo or on the background of pre-existing chronic kidney disease. About 40% of patients who recover from acute kidney injury have persistent renal dysfunction, and many develop chronic kidney disease. The mechanisms of kidney injuries with infections are also divergent. Infections cause kidney damage through direct invasions by the offending microorganism, leading to phytopathic injury as observed in pyogenic infection, TB, leptospirosis, and nematode infestations. Following tables present viral infection and associated nephropathies. Examples for acute infection: dengue virus, acute tubular necrosis, glomerulonephritis, meningoproliferative glomerulonephritis, hantavirus, acute tubular necrosis, meningoproliferative glomerulonephritis, parvovirus, hepatitis A virus, hepatitis B virus, cytomegalovirus, Epstein-Barr virus. All are involved in acute renal involvement. Subacute include parvovirus, Epstein-Barr virus, hepatitis B or C virus. Chronic hepatitis B, HIV, hepatitis C. Hepatitis B virus, membranous infection or membranous glomerulonephritis. Hepatitis C virus, membranoproliferative glomerulonephritis. HIV, focal segmental glomerulosclerosis, and others. Hepatitis E virus infection, which was initially thought to be a disease limited to some part of the developing world only, is now increasingly recognized in many countries of the developed world. Hepatitis E virus infection is reported to be associated with different renal syndrome. Hepatitis E virus can cause glomerulonephritis in both immunocompetent and immunosuppressed patients. Many cases of glomerulonephritis, which included membranoproliferative glomerulonephritis with and without mixed cryoglobulinemia and immunoglobulin A nephropathy, have been described. Decline in estimated glomerular filtration rate with hepatitis E virus infection has been shown in renal allograft recipients. The improvement in renal function and the decrease in proteinuria level following hepatitis E virus clearance, either spontaneously or following therapy, suggests the causal relationship between hepatitis E virus infection and the associated renal injury. European Association for the Study of the Liver have recently formulated a guideline on the management of hepatitis E virus infection in different clinical settings. Human immunodeficiency virus, renal disease, and HIV infection manifest in many ways, varying from direct invasion by HIV, formation of immune complex related to drugs used for treatment, dehydration, and various other bacterial and viral co-infections. The demographic of hepatitis of HIV, human immunodeficiency virus, associated renal disease depending on the population being reported. In the United States and Europe, where highly active antiretroviral therapy is prevalent, non-collapsing focal segmental glomerulosclerosis is the most common glomerular lesion. Dengue virus is a worldwide infection with 40% of the global population living in endemic area, especially Southeast Asia and the Pacific Islands. Infection occurs through the bite of female. Its Egyptia dengue is classified into specific syndromes: dengue fever, dengue hemorrhagic fever, and dengue shock syndrome. Hantavirus are RNA virus that belong to the Univiridae family with wild rodent as reservoir. Renal involvement may occur up to 30 to 40% of cases. Two syndrome can develop: hemorrhagic fever with renal syndrome, also called nephropathica epidemica, and hantavirus pulmonary syndrome. Parvovirus may be associated with three different clinical settings in nephrology brackets: glomerulopathy, anemia in end-stage renal disease patient, and pure red cell aplasia post-renal transplantation. Polyoma virus. Polyoma virus is virus with seroprevalence of 70 to 90% in adult, showing reactivation intermittently in both immunocompetent and immunosuppressant individuals. Other viruses, cytomegalovirus and Epstein-Barr virus, can cause acute immune complex glomerulonephritis, and a membranous lesion has been the most common histology reported. Respiratory viral infections such as respiratory syncytial virus, influenza virus, and varicella have been associated with relapse of infection. Bacterial infection. The association of bacterial infection with kidney injury is diverse. A list of bacterial infection and association in induced nephropathies will be discussed later. Most common ways by which bacterial infection causes renal dysfunction is acute kidney injury, which occur as a part of multi-organ dysfunction due to sepsis, systemic inflammatory response, hypotension, hemolysis, or hepatorenal syndrome. Direct invasion of renal tissue by various bacteria, either through ascending infection or through hematogenous spread, lead to urinary tract infection, which may lead to renal dysfunction in the form of pyelonephritis. Post-streptococcal glomerulonephritis. It's usually affects children age from 2 to 14 years old. Nephrogenic group Streptococcus pyogenes, causing either impetigo or upper respiratory tract infection, usually precede nephritis. Post-streptococcal glomerulonephritis is rare in industrialized countries and also decreased in developing countries because of improvement in public health and frequent use of antibiotics. Post-streptococcal glomerulonephritis is an immune-mediated glomerulonephritis caused by immune complex deposits, subendothelial and mesangial locations, consisting of bacterial antigen, glyceraldehyde 3-phosphate dehydrogenase, and streptococcal pyrogenic exotoxins P. Infection-related glomerulonephritis. It's defined as renal dysfunction due to glomerular inflammation with evidence of ongoing infections at other sites. Though incidence has decreased in industrialized countries, it still contributes to about 5% of all glomerular disease, and probably more in underdeveloped areas. Now supported more commonly in adults than in the past. Age shift is likely due to the improved life expectancy, higher incidence of infections in elderly, and diabetes. mycobacterial infection. In Southeast Asia and Western Pacific region, TB is still a major public health issue and is expected to pose greater challenge with emergency of multi-drug resistance and co-infection with HIV. Involvement of the genitourinary tract is seen in 6 to 8% of all cases of extrapulmonary TB. Hematogenous spread of mycobacterium to the kidney with gradual asymptomatic progression of the disease leads to delay in diagnosis. Involvement of urinary bladder and ureter lead to obstructive neuropathy. Extensive destructive caseous lesion, ulceration, and dystrophic calcification involving renal parenchyma lead to chronic kidney disease. Most common organisms are Candida species, including Candida albicans, as well as non-albicans, and less common fungi are filamentous fungi, like Aspergillus and others, and rare are endemic fungi, like Histoplasmosis. Spread may be ascending, like Candida, or hematogenous, like Aspergillus, or endemic fungi. Diagnosis: tests to differentiate Candida colonizations from infection have been not standardized. In contrast, presence of filamentous fungi, Aspergillus, and endemic fungi, Blastomyces, almost always reflect infection. Treatment with systemic antifungal therapy or surgical removal of obstructing mass is usually required. This image reflects a case of Streptococcus infected scabies lesion is interdigital web area of the hand. Picture P, proliferative glomerulonephritis with neutrophilic exudate. C, immunofluorescence show starry sky pattern of immunoglobulin deposits. D, sub-epithelial humps of immune complex on electron microscopy. Protozoal and parasitic infections and their effect on the renal system. There are more than 342 parasites which affect human, and at least 20 of them are associated with kidney-related affection. Plasmodia, Filaria, Leishmania, Schistosoma are common with diverse epidemiological distribution. The immunogenic and pathogenic host response to these infections are common in many situations with widely associated spectrum of kidney disease, which extend from acute kidney injury to glomerulonephritis, amyloidosis, urologic disorder, and malignancy. Malaria is one of the most common protozoa infection which involve kidney. Malaria is endemic in Asia, Pacific, and Africa, and may be the cause of acute kidney injury in 2 to 39% of such cases in different series. Leptospirosis is caused by spirochete. Leptospira is a zoonosis endemic in tropical climate. Infection is transmitted to human through animal urine. Due to high seroprevalence in endemic area, it has been implicated in development of Mesoamerican nephropathy. Leishmaniasis or Kala-Azar is caused by Leishmania species. With humans as a reservoir and sandfly as a vector, Leishmania primarily affect reticuloendothelial system, and renal involvement is associated with visceral Leishmania. Characterized by fever, malaise, weight loss, hepatosplenomegaly, and lymphadenopathy, renal histology is varied from chronic interstitial nephritis, membranous and amyloid deposits. Acute kidney injury has been reported in children with visceral Leishmania treated with systemic antimonial drug. Schistosomiasis is endemic in Africa, South America, and Far East. Of the infected subjects, 60% are symptomatic and 10% have renal dysfunction. Lower urinary tract is the primary site of schistosomiasis, especially Schistosoma hematobium infection. Granulomatous response around its ova produces small pseudotubercle in the bladder mucosa which consolidate to form sessile mass and ulceration. We discuss all infection that affect renal system in brief. Thank you.